For CMML has long been grouped in with MDS, and I think that's been a disservice to CMML patients in the treatment, in our understanding of the treatment of CMML, and that really we need to understand what are the specific therapeutic goals and the best ways to achieve those goals in CMML in particular. HMA therapy, as has been discussed, is maybe not the best treatment in terms of controlling the disease from a mutational standpoint, and maybe unsatisfactory in terms of really impacting some of the relevant endpoints in this disease. So new therapies that can be added on to hypomethylating agents or replace hypomethylating agents are really needed in this disease, and some excellent work with Eric Bergeron's group looking at ruxolitinib has been really inspiring and really interesting to try to move that forward, and we're interested in trying different combination approaches as well with JAK inhibitors. But I think understanding the outcomes of these patients and in specific CMML and not just grouping them in with MDS is really needed to really move that field forward.